You want me to start?
Sure. Yeah. People are
Okay.
rolling in. You can
Okay.
start.
Yeah. We'll wait for people to get it. Yeah. Okay. Well, hello and welcome, everyone. You are joining Maternal Mental Health Leadership Alliance in partnership with Postpartum Support International, hosting our webinar today on 3 ways to advocate in May, which is Maternal Mental Health Awareness Month. So welcome. We're so grateful that you are taking time from your busy day to be with us. We will keep it exactly to an hour so that you can get back to the business of your everyday life. Again, we're just so grateful that you're joining us. We have some terrific speakers today. And my name is Adrienne Griffin. I'm the Executive Director of Maternal Mental Health Leadership Alliance. And again, on behalf of our partners at Postpartum Support International, I welcome you today to our webinar on advocacy. Next slide, please. So a few housekeeping items before we get into the meat of our discussion today. At the bottom of your screen, if you wouldn't mind using the Q&A button if you have a question. You can also select the show captions button to show live captions, and the reactions button to share an emoji. And if you want to, in the chat, go ahead and please drop in your name or where you're from, just so we have an idea of who is joining us today. So after this webinar, we will email you several items, a brief survey to get your feedback. We're always looking for ways to fine tune our presentations. You'll get a copy of this PowerPoint presentation, as well as the webinar recording, and a link to our website where we will host all of these items for you to check out later, share with your friends and colleagues. So again, be on the lookout, and I'll remind you during the course of this that again, we will be sharing the PowerPoint and the webinar recording at the end of this webinar. Okay, next slide, please. Great to see people dropping in the chat where they're coming from. So here's what we're going to cover today. 3 ways you can advocate in May. So first is raising awareness with social media campaigns and information about the National Maternal Mental Health Hotline. The second way is to write an op-ed or a letter or a blog post. And we've got templates for all of these things. And then the third way is to email your elected officials. And again, all of this information, templates, wording, all of that will be shared with you afterwards. So just you can just hang on and enjoy the ride today, and we'll share all the information with you after the presentation. Next slide, please. So just a little bit about me. I actually call myself an accidental advocate. If you had ever told me before I had children that I would be doing any of this work, I would have laughed at you, because that was the furthest thing from my mind. On the left-hand side of the screen is my life before children. I graduated from the Naval Academy. I worked at the Pentagon and the White House. By the time I was 30, I had a master's degree in public policy from Harvard. I had worked at the United Nations, and I thought I was going to rule the world. I really thought that I was going to be like Secretary of State or Secretary of Defense. And then, Mia, if you would just show my next little picture. And then I had this beautiful baby boy, and I had severe mentally rocked my whole world. And so if you click again, I decided to pivot and do something to help others so that they would not experience what I went through. And so I started volunteering with Postpartum Support International probably about 20 years ago. I was one of their phone volunteers in Virginia. But because I am that type A overachieving person, it wasn't good enough just to be a volunteer. I needed to start my own nonprofit in Virginia, which I ran for 10 years, providing support to new moms on the phone and via email and running support groups, and pretty much like what the Postpartum Support International chapters do now, but I was doing it before there were chapters. And then about 5 years ago, came to Maternal Mental Health Leadership Alliance to focus on national policy. So next slide, please. So just a word or two about MMHLA. We are a nonpartisan, nonprofit organization, and we're really dedicated to improving the mental health of mothers and childbearing people in the United States by really focusing on national policy and on health equity. And so we do lots of things around policy and advocacy work like we're doing today. We also do things, provide lots of information to uplift the field of maternal mental health with our newsletters and fact sheets and various other things. Okay, next slide, please. So today I am thrilled to be joined by two wonderful women, Laura Kilgore from PSI, from Postpartum Support International, who will be talking about the Blue Dot Project and World Maternal Mental Health Day, and Christina Delaney, who is going to be speaking about Pregnancy and Postpartum Psychosis Awareness Day. We were also supposed to be joined by Patience Riley from the Perinatal Mental Health Alliance for People of Color, who is really leading efforts at PSI around World Maternal Mental Health Day, but unfortunately she was called away with a family emergency at the last minute. And so Laura is going to be stepping in for her. Next slide, please. So let's just set the stage and talk just for a minute or two about the maternal mental health crisis in the United States. Next slide, please. I'm guessing that most of you on this call recognize that maternal mental health conditions are a range of illnesses, not just postpartum depression, but also anxiety disorders, OCD, post-traumatic stress disorder, bipolar illness, psychosis, and substance use disorders. And wait a second, did I just see that somebody is dialing in from Nigeria? Oh my goodness, how cool is that? Welcome, welcome. Wow, okay, that's just, wow, that's so cool. Okay, next slide, please. What time is it in Nigeria? Let's see if it's noon here. It's like 8 o'clock in the evening. Wow, thanks for being with us. Okay, just a few other facts and figures to make sure. 5:07, thank you. Okay, so these illnesses impact 1 in 5 mothers or other childbearing individuals, and they are the most common complication of pregnancy and childbirth. About 800,000 families each year are impacted by these illnesses. When people say, in fact, mental health conditions are unfortunately the leading cause of maternal deaths. We know that suicide and overdose combined are the leading cause of death for women in the first year following pregnancy. Next slide, please. And the cost is significant. $14 billion each year in not treating maternal mental health conditions. That's $32,000 per mother-infant pair in the United States. And sadly, the vast majority of people who experience these illnesses actually remain untreated. That 75% of people who experience these illnesses do not get the treatment that they need. And this increases the risk of long-term negative impact on mother, babies, and families. And that's why we're so concerned about these issues. Next slide, please. We also know that certain individuals are at increased risk for experiencing maternal mental health conditions. And these are just a few of the high-risk groups that include people of color, as well as LGBTQ individuals, individuals who are impacted by poverty or who are economically disadvantaged, women with disabilities, as well as military service members and their spouses. And we're going to talk a little bit about that later. We're actually focusing on military moms with some new legislation this year. Next slide, please. Okay, so that sort of sets the stage about maternal mental health conditions. And now just a couple of minutes to actually talk about advocacy, what it is, how we can do it, and how people can be involved. All right, next slide, please. So quick overview. Here's what we're going to dig into for the next 10 minutes or so, kind of talking about what is advocacy, what are the goals of advocacy, and who can be an advocate. Okay, next slide. So I want you to think very basic. Advocacy is about education. It's about raising awareness about an issue, as well as providing some information about how to take action. So there's some formal definitions there, the act or process of supporting a cause or a proposal, publicly recommending an action or a plan, raising awareness, and providing information about an issue. So advocacy, again, just if you think very simply that advocacy equals education, you're all set. Okay, next slide, please. So why is advocacy important? Well, it's really important because it both raises awareness about an issue and offers a solution to the problem. So earlier, when I laid out all of those issues, those are the concerns. And now we're going to be talking about how to offer solutions to address those issues. Next slide, please. So who or what is an advocate? So advocates are people who provide information, knowledge, and experience. So all of you on this call, I want you to now think of yourself as an advocate, and we are all absolutely necessary to address this particular problem of maternal mental health conditions. Next slide. And so who can be an advocate? Anybody can be an advocate. Most often we think about individuals with lived experience who speak from that perspective, but it also could be family and friends, as well as providers who interact with pregnant and postpartum people. And so, for example, we'll hear from our other presenters about what brings them to advocacy work. But I often hear providers in the field talk about why they are motivated to do this work, whether it was because of their own personal experience or that of a loved one, or just a compilation of the women and the patients that they have seen that motivates them to do this work. So again, anybody can be an advocate. Next slide, please. So a couple of topics that we're advocating for right now are three particular things. So number one is funding for the National Maternal Mental Health Hotline. Number two is funding for maternal mental health and substance use disorder programs. And number three is co-sponsoring new legislation that we've introduced to support military mothers. So these are the issues that Maternal Mental Health Leadership Alliance is advocating all throughout this year. And we do particular things like we had an advocacy day, we write letters to Congress, and we encourage people like all of you on the line today to reach out to your elected officials and share information. So this will be actually one of the things that we share today as a way to advocate. Next slide, please. And then again, what are the goals of advocacy? So really think about them in two ways. Some is to provide information directly to policymakers so they can create and implement effective legislation and policies. And that's a lot of what Maternal Mental Health Leadership Alliance does. We talk with members of Congress and their staff. We let them know about these issues, and we help them come up with legislative solutions. And if any of you participated in Advocacy Day, you are actually part of that effort as well. So Advocacy Day is a day that we set aside in March every year where we bring together advocates like this in a webinar or in on Zoom calls to talk with elected officials and their staff to help explain these different issues that we're advocating for. So there's that sort of direct advocacy that some people, it's actually lobbying when we're talking specifically to our elected officials about issues. Lobbying is a subset of Advocacy Day. And then the second thing is what we're going to be focusing on now and throughout the month of May is really raising public awareness about an issue, which in turn provides pressure on those policymakers to address the issue. So we do that direct advocacy right to our elected officials and those who are making policies and programs, as well as then providing that public awareness, as you'll see through social media, through letter writing campaigns, and other ways. So sort of a two-front effort. Next slide, please. Okay, so why are we doing this now? Well, May is Maternal Mental Health Awareness Month, and so it seems appropriate that we should continue advocacy opportunities during May. We have to think of advocacy as going on all throughout the year. Again, from where we sit with leading sort of federal advocacy, we have a very strong timeline focused on getting funding, and that's usually in the first half of the year. Then we want to continue that awareness all throughout the year. So that's why we're focusing now on May as Maternal Mental Health Awareness Month. Next slide. Okay, so we are now going to pivot, and I'm going to pass it off to our wonderful partners on the call to talk about specific maternal mental health social media campaigns during May. Next slide. So we have actually three campaigns that are undergoing or will be underway in May. So the first is May 1st, which is World Maternal Mental Health Day. So this is other organizations all around the world, like our friend from Nigeria, who will be raising awareness about World Maternal Mental Health Day, which is always, I believe, the first Wednesday in May. So this year it falls on May 1st. We'll also be talking about Pregnancy and Postpartum Psychosis Awareness Day, which I believe is always the first Friday in May. So this year it's May 3rd. And then the Blue Dot Project, which will be elevating maternal mental health during that first week in May. So it's 3 separate campaigns. We're going to give you information about all of them. You can choose to participate in 1, 2, or all 3 of them, but we just want to give you as much information as possible to help you in your job as advocates. Next slide. And so it gives me great pleasure to welcome Laura Kilgore to the podium, the virtual podium. Laura works at Postpartum Support International, and she is going to be speaking both about World Maternal Mental Health Day. And remember, this was supposed to be patients who unfortunately was not able to join us. And so Laura has quickly become the expert. And, you know, I'm just prefacing that. So if there's a question or something that Laura might not be able to answer, we can certainly get that to you. So I'll pass it off to Laura to give yourself a little bit of an introduction and then take it away.
Perfect. Thank you. I'm Laura Kilgore, and I'm located in Southern Oregon, and I am a survivor of maternal mental health disorder myself. So I am just as much of an advocate as someone who happens to just work in this field and have had opportunities to attend DC and speak to our different legislators, and it's super empowering and something I also thought I could never do. And it's so much easier than I thought it was. It's not as intimidating as it sounds. So we can go to the next slide and talk about the forum that's coming up. This year, oh, wrong one. No, sorry, I'm talking about multiple things. So this year for World Maternal Mental Health Day, the theme is Stronger Together, and I think it's perfect that it falls on May 1st this year. It's the best way, I think, to kick off the month and really focus on maternal mental health. The focus about it is raising awareness, which is a form of advocacy, just as Adrienne talked about, right? It's education. So there's a toolkit that they offer that we have that makes it as easy as possible, and it is multiple languages. So you can go in there and just pull content to share, as opposed to having to like create, you know, the wheel and try to figure out how can you how can you share stuff, as well as going to their what am I saying? Their social media, and then you can just share directly from there. So we can go to next slide. So there's, like I said, there's a lot of ways to get involved. You can do it through social media and using the hashtag World MMH Day and MMH Matters. There's blog posts you can share. There's multiple events like what we're talking about here. And there's events that are happening all different places in the world, and they're listed on our website, where you can figure out if there's something close to you that you want to participate in, as well as there's a petition to sign that is all located on the website on that Get Involved link right there. So we have the toolkit for the social media posts, as well as a toolkit with a press release and templates for it. There's a lot of great resources, and we've tried to make it as simple as possible. So anyone, you know, can just click. It's just a few clicks to share that content, and then you've done. It may seem like a drop in the bucket, right, of just your own social media account, but truly the ripple effect is larger than I think we could even measure of those, you know, people who see it. So we can go to the next slide. This year, our PSI has the Perinatal Mental Health Alliance for People of Color, and they have a really exciting forum that's coming up because it's the first forum that is all in Spanish and it's free. There's going to be different speakers. We can see there's a bilingual documentary, as well as different networking events. This is not just for the US, this is a worldwide event. So it doesn't matter where you're located. Like I said, it's in Spanish, which is really exciting for us this year. You can go to the next slide. Here are some QR codes. They also have a toolkit. You can sign up to register for it. And like I said, it's free. So there's no barriers there as far as being able to attend. And there's the QR code for the toolkit. And as you can see, they've created beautiful content and yeah,
Ah,
beautiful content to share that has, like I said, it's all in Spanish. I believe they also have English versions of this content that you can share as well. Yeah, next slide.
all right, so before we leave the World Maternal Mental Health Awareness Day, just want to point out again, that's May 1st. And I saw in the chat that it's Erin's birthday in North Carolina, so a great day to do this. And I know that there's been planning calls going on for many months about this. Postpartum Support International is sort of taking the lead. Oh, it's also Erica's birthday, yay! PSI is taking the lead, and there are countries all around the world participating. I know there's a strong contingent from Australia and New Zealand, and several countries from Europe. And so it's really going to be a terrific way to raise awareness all around the world on the same day. So thank you, Laura, for stepping in and talking about that. You did a great job. Okay, so next up is a good friend, Christina Delaney, who runs a nonprofit in Tennessee called Cherished Mom. And for the last few years, Christina has been leading an effort to address pregnancy and postpartum psychosis awareness day, along with Teresa Toomey and some other advocates who have experienced pregnancy or postpartum psychosis. And so, Christina, we're so excited to hear from you about the advocacy work around psychosis.
Awesome. Thank you so much, Adrienne. And thank you all for being here. I think this maternal health space, specifically the maternal mental health space for us, is just full of passionate, energetic, and amazing people, with most of us having a lived experience of our own, which I think fuels the work that we do. And it just is an incredible space to be a part of. So I'm just so grateful to be here. I am Christina Delaney, and I share the same sentiment as Adrienne, being an accidental advocate. I am a registered nurse by background. I've been a registered nurse for 15 some years now. And about almost 10 years ago now, I had my own experience with postpartum psychosis, which really changed everything for me. I am not one to like public speaking, and never saw myself being, having that sort of role, and certainly didn't see myself being such a face for postpartum psychosis. And it's not something I take lightly, but here we are. And like I said, I'm grateful to be here. You can go to the next slide, please. So I started Cherished Mom back in 2018, and Cherished Mom kind of leads the efforts around the Pregnancy and Postpartum Psychosis Awareness Day. And I believe it was actually in 2020, I was talking to Teresa, another survivor friend of mine, and I told her, I was like, we need to have some kind of awareness day around this. There's just not enough. There's still not enough, but we need to do something more. And that's kind of where the awareness day was born. And we did as much as we could that year. And I think we've been growing and doing different things every year. And so we're just excited to have more awareness and education about perinatal psychosis, because it's extremely misunderstood and heavily stigmatized. And we feel that awareness and education are the key to preventing trauma and tragedy. Next slide, please. So this year, our awareness day is on May 3rd, which is on a Friday. And usually it's kind of towards the end of Maternal Mental Health Awareness Week. So we're kind of in a different ball game here this year, kind of in the middle of the awareness day and week. So we're really excited about that. So in 2022, we created our logo And we really, Cherish Mom has a butterfly in our logo. So I wanted to keep the butterfly, and you can see the mosaic there, which really symbolizes broken pieces, turning into something beautiful. And we really thought that was important to put into the logo. And you can also see the blue dot is also a part of our logo, and that was very strategic as well. And Laura's going to talk to you here in a little bit about the blue dot campaign. And in 2022, we also started our moth storytelling cohorts, which we have hosted for, we're about to start our third one this year, which brings together survivors to learn to craft their story and tell it live on the Awareness Day. You can go to the next slide, please.
A quick question for you, Christina. Does moth stand for something, or is it like representative with the butterfly, the moth and the butterfly together?
So the Moth is a standalone, they're a separate nonprofit that we are partnering with it's part of their community efforts and projects. So Cherish Mom sponsors that, and we offer that cohort every year to craft and tell their stories.
Got you. Thank you so much for
Yeah.
clarifying that. Appreciate it.
Absolutely. Great question. Next slide, please. So our biggest reason for having the Awareness Day is really to provide education and awareness around perinatal psychosis. We really want to foster meaningful partnerships and secure sponsorships, and really seek to raise awareness, education, prevent trauma, provide support for perinatal psychosis for survivors and their families, and really the community and healthcare providers as well. Some of our goals this year are to continue to raise awareness, uplift survivor stories, decrease stigma that really exists around this illness. We want to share survivor leader insights, prevent trauma and tragedy, like I already said, train perinatal healthcare providers, first responders, mental health providers on recognizing, responding, and supporting those that have perinatal psychosis. And this year, we're really excited to have a donation match through Postpartum Support International from it started yesterday through the middle of May to really expand our efforts and reach. And another thing we're hoping to do this year is send survivor advocates to the PSI conference. And we hope to start that this year and continue it every year as well. So we really hope you'll get involved and share our social media efforts and like us and comment on our stories and post on social media. We're on Facebook, Instagram, and LinkedIn, our primary ones. And so we're really excited to just continue what we're doing and building that awareness and building community around perinatal psychosis. You can go to the next slide. So that's what we're doing this year. We've got that match with PSI, which we're really thankful for their partnership in that. You can go to the next slide. And we're still having our moth cohort, like I said, starting in this week, actually, on Thursday. So there are so many ways to get involved with us, and I can put some links in the chat too. So you can join our newsletters and stay updated. You can share about us in your own circles and your networks and what we're doing. Contact us for more possibilities, and of course donate, and that is our link to donate there. And I'll also put a link in the chat to join our newsletter, and we have an ambassador kind of checklist of things you can do and get involved with there as well. And again, thank you so much for your time, and thank you for being here, and yeah, thank you.
Thank you, Christina. So one of the fabulous things that Christina and Teresa and some of the other psychosis advocates did was last year at the Postpartum Support International Conference. They did a terrific panel discussion with movies of advocates telling their stories. And it was so well done and so moving and so important that people understand and recognize the difference between perinatal mood and anxiety disorders and postpartum psychosis. And this is just amazing to me. When I think back, 20 years ago, when I first started getting involved in this work, there was no differentiation. People like didn't understand, it was just all called postpartum depression, right? And now not only do we have awareness days, but we have specific awareness days about the most complex of these illnesses, perinatal pregnancy and postpartum psychosis, and just how much the landscape has changed, how much more we're talking about this. And it's all because of advocates like all of us who have, been talking about this, raising awareness, speaking about what happened to us and how we overcame these challenges and how it's impacted our life. So thank you, Christina. I know this has been your life's work for the last decade or so. And so just thank you for all of this. Really so proud of all that you and the other pregnancy and postpartum psychosis advocates and survivors are doing, saving lives every day. Okay, next slide. So I'm going to turn it back over to Laura. She is going to now talk about the Blue Dot Project, which is really her area of expertise. And so Laura, take it away.
Thank you. Yes, the Blue Dot Project, that's my zone. You can go to the next slide. There we are. You can go to the next slide. So the blue dot is a symbol, the national or symbol for maternal mental health. And I was telling Christina earlier, I just love her logo that she incorporated the blue dot. If you think about the pink ribbon, I think most people, when they see a pink ribbon, recognize that that's for breast cancer awareness. And so the blue dot is the same thing, but for maternal mental health. So anywhere you'd stamp a pink ribbon on something, use a blue dot for maternal mental health because we want to get that symbol out there and get it known. You can go to the next slide. So this year, maternal mental health awareness is on the first full week of May, which is May 5th through the 11th. Yeah, typically World MMH Day falls on that Wednesday, and then we have Postpartum Psychosis Day, which is on that Friday. And this year they're a little bit different, which I kind of like because then it just spreads out the awareness throughout the month a little bit. And the purpose of this campaign is to raise awareness and get that symbol out there, as well as combat the stigma and shame that surrounds these different disorders. Our theme this year is storytelling saves lives, and I truly, truly believe in that. And it's perfect because storytelling is kind of lining up with all these other campaigns. And that right there, sharing stories, hearing stories, helps normalize these different disorders, as well as help spread awareness. A lot of times people don't realize that maybe they suffered from a disorder while they're in it. Most of us don't, even us, moms who are maybe a little bit educated on these topics. I'm 6 years postpartum and I'm still piecing things together of like, oh, that was my experience. I did go through that, and maybe my own ideas of what I thought these disorders were and how it manifested in my life. You can go to the next slide. So there's so many ways to get involved in our campaign. We invite moms, organizations, brands, anyone and everyone to participate. We have a toolkit. So we tried to make it as simple as possible so people don't have to, we don't have, none of us have endless amounts of time to create social media content. So you can just go straight to our toolkit, grab some images, grab some like the text to go with it, post it, done. What's even easier is just to repost our content that we'll be posting throughout the week as well. We will be sharing each day a different story from women who've experienced all different walks of lives, all different disorders, and how they navigated through that, how they found help and support, and where they are now. Our hashtags are MMH Week 2024, as well as Storytelling Saves Lives. You can see there's pictures from past campaigns of women with their hand up saying I'm 1 in 5, to also show that and normalize and show how common these disorders are. And a lot of the stats that we'll be putting out there are pretty shocking. It's the #1 complication when it comes to childbirth, which that right there, when I first heard that, was kind of sets you back a little bit. So really spreading the awareness, showing people that it's, not just, it's common, it's more common than not, and that there's hope. And so the cool thing about this campaign is that we show, here are the stats. And this year we were able to, we recently had our research team pull the most recent stats again, because after a while, right, time goes on and there's new stats. So this year we have the most current stats we possibly can, which is really cool. And where was I going with that? I don't know. My brain just left me, but so there's our toolkit. You can subscribe to the Blue Dot Bulletin, which is our newsletter. I'll drop that link in there. Each month we put out a new newsletter that will either cover awareness days, different events coming up. We also have articles that we're reading, as well as social content that caught our eye. And we have an ambassador program where anyone and everyone can get involved, and there's as little commitment or as much commitment as you want to this. There's lots of different ways. So I'll drop that link. I'll drop several links in at the end. And next slide. And I believe that might be my last one. So if you have any questions, my email is laura.k@postpartum.net. I'm happy to answer anything, try to figure out how, if you want to share your story, that's another way. If you don't want to share your own story, or you know another story, you don't have to be personally impacted by a disorder to participate. You can, anyone and everyone should be posting and spreading awareness. So I just encourage you to check out those resources. Oh, this is what I would say. The cool thing about this campaign is we spread the awareness, and then that feeds into PSI. PSI offers the support aspect and helps you find local resources. So not only are these stats out there, and then it's like, okay, then what? What do I do now? Now that I know this is a common thing, like if I need help, we direct you straight to PSI, where they offer support. They have over 50 different peer-to-peer support groups. They are constantly coming up with new ones. We just came out with an ADHD mom one. There's endless amounts. You think about a certain topic, we'll create a support group for it. So thank you so much for tuning in, and hopefully we'll see you on social media.
Yeah, thank you, Laura. So I was thinking, I'm wearing my dot scarf, and it's sort of the same color blue. I'm like, can you make a blue dot scarf, like a white scarf with blue dots? Like, I would buy one in a second.
Yeah, we do have a shop that I'll drop that link in there. That's got a couple of things. We'll be at the PSI conference this year and kind of bring some swag with us as well.
Yay.
And stickers and things like that. But yeah, we are trying to get as much out there. We've got shirts that say I'm 1 in 5 with a blue dot. We've got cute hats, lots of different things.
Yay,
So,
yay.
yeah,
So I was gonna, when you were talking about, the 1 in 5, most common, 800,000 people, like when we hear some of those statistics, like some people, it's like, oh my gosh, I didn't realize it was so common, and it like helps to normalize it, right? As opposed to thinking I'm the worst mother in the world, I'm the only one who sounds like this. Yeah. Yeah. Oh, instead of the pashminas, right? Do a blue dot scarf. Oh, maybe we're onto a marketing thing, Christina. Oh yeah.
We're gonna have to find where and how to do that. We don't have an inventory, so we're just using like print on demand different sites. And so finding one that offers all of the things is challenging.
Yeah.
But yeah, we have lots of ideas out there, and certain things that we don't have in our store will be at the conference. So definitely check that out as well.
Awesome. So lots of stuff going in the chat. And all of those links, Laura, that you talked about, we can include in the the information that we'll push out to people afterwards. Yeah.
Perfect.
Yeah.
Perfect. Thank you so much.
You bet. Thank you for all you're doing. Okay. So now so those are the 3 social media campaigns that are going on. So the next thing we want to talk about is raising some awareness around the National Maternal Mental Health Hotline. So next slide, please. Just in case you don't know about the hotline, this is one of the things that we all in the whole community are just so thrilled about. It's a 24/7 voice and text hotline, providing services in English and Spanish, as well as translation for many other languages. All of the counselors most of them are women who have lived experience. They are all trained either as nurses like Christina, or mental health providers, or certified peer specialists. And again, great resource. I remember how helpful this would have been to me. I was up in the middle of the night, feeding my son what seemed like 12 times a night, to be able to have texted or talked with somebody in the middle of the night would have been so incredibly helpful. So what we want you to do is help share information about the National Maternal Mental Health Hotline. Next slide, please. And is there a link to their website? Yes. Okay. So they have all kinds of promotional materials. They have little cards, which I have here in my desk. They have posters, they have social media posts. There's a link to a partner toolkit with all kinds of shareable materials. So go ahead and download, you can order these little cards for free, take them to, I don't know, your doctor's office, to your mom's group, post things on social media. They have magnets you can give to friends. We're starting to do things like include these little cards to be included in hospital discharge packets. So anything that you can think of anywhere in your community that you want to raise awareness about the National Maternal Mental Health Hotline. So that's a really easy thing to do. We have the link in there, takes you to a great website that's hosted by the Health Resources and Services Administration, which is one of our government agencies. There may be more exciting things to talk about the hotline coming up on the 2nd anniversary of hotline operations in May. And helping thousands of women and families around the country. So thrilled about the hotline. Okay, next slide, please. All right, and then the final opportunity is to actually, no. Okay, so that's all the awareness. Now we're going to switch gears and talk a little bit about writing an op-ed letter or a blog post. So next slide, please. Why write an op-ed or a letter or an article? Because storytelling plus facts and figures make advocacy more compelling. And so, when I talk about writing an op-ed or a letter, I want you to think more like, okay, how do I just raise awareness by telling my story and maybe, adding some facts and figures with a call to action. And the call to action can be simply call the National Maternal Mental Health Hotline if you're a new mom. Okay, next slide, please. So who can do this? Again, anybody can, whether you're an individual with lived experience, are you a family or friend of somebody who experienced these conditions? Are you a provider? All of us have a story to tell, which is kind of the hook in writing an op-ed or a blog post. Next slide, please. So you can do everything from taking our template, which we've got a template online, which we'll share with you on our link. You can take what we've got and use it to write a blog. If you are already, have someplace like you can post it, like say on Christina Delaney, if you on your Cherished Mom website, if you do blog posts, like here's a sample one that you can do. You can write an article for publication. You can submit something to your local newspaper. And we have templates. We have like a short version and then a longer version. Most of it is like me telling my story. So you can kind of see like how I weave my story in when I'm doing this kind of work. And next slide, please. These are some suggested touch points when you're writing your letter or your article. So if it's your personal experience, it can be, my story experience or how I felt, how I recovered, what might have been the biggest challenge, how you overcame it, maybe something you wish you had been different, kind of short and sweet. Storytelling in an advocacy capacity is very different than if you were sharing your story with, say, a friend or a therapist or a support group where you may want to go into details. In the advocacy world, it's a little bit different. You want to be just maybe a little bit more concise. So oftentimes I will say, like I did at the beginning, I did all of these great things. I thought I was so great. And then I had this baby and my whole life was turned upside down. And it took me 6 months to get the help that I needed, despite having every resource available to me. And I kept thinking, if it's this hard for me, what about people who may not know that something's wrong, don't have support, can't advocate for themselves, face other barriers? So that's why I became an advocate. So, I sort of try to take what my many months experience and sort of condense it into about 30 seconds or sometimes like 3 sentences if I'm writing. Can also talk about somebody else's experience. Did someone or love experience a maternal mental health condition? What was the impact? If it was your mom, your sister, your friend, in your work, what stories have you heard? What impacts you the most? You don't have to talk about a patient. You don't have to disclose anything specifically, but you can say, I've seen over the years X, Y, and Z. Or I remember working with this one mom And this was the message that I took away from it. So again, we want to condense our story down to be relatively short. It's the hook to get somebody to read further. Next slide, please. So an effective op-ed letter or article kind of identifies the issue, makes it personal, kind of short and sweet, offers a solution, and then makes the ask. And so you'll see in the template that we've laid out, I sort of do this very same thing. I talk about maternal mental health conditions are the most common complication of pregnancy and childbirth. I experienced it. It took me a long time to get help. If there had been a hotline, that would have been more helpful for me. So I offer the solution, and then I make the ask, fund the National Maternal Mental Health Hotline. And again, all of this is in templates on our website. Next slide, please. So again, here's sort of my outline. I experienced these issues 20 years ago. It took me 6 months to get the help I needed. I could have benefited from the National Maternal Mental Health Hotline. So instead, I started volunteering 20 years later. I lead national advocacy efforts, and I still wish there had been a hotline. Now there is one. Please fund the National Maternal Mental Health Hotline. Okay, next slide, please. All right, so people always ask, how do I submit a letter to the editor? Now, I'm not talking about writing to the New York Times or the Washington Post. Your local newspaper is every bit as important, right? People will see it online. We may be targeting a slightly different demographic. People who still read the newsletter may be parents of somebody who's having a child who may be going through postpartum depression or anxiety. So it's pretty simple. Just go to your local newspaper's website, and every website is different. So I've looked at bunches. I was trying to come up with, here's a simple way to do it. Unfortunately, everyone is different. So you can do a couple of things. You can search that everybody will have a little search bar. How do I submit a letter to the editor? And it will take you there. Or you can search down at the bottom, often under the contact information, there'll be a little drop down that's like, submit a letter to the editor. Also sort of in the thing where like you're submitting information about maybe a local event or an obituary notice. It's sort of like under the community or contact information. Some newspapers, will ask that you actually send them an email, but many of them have an online form. And those online forms are often very either character control or number of words control. And so that's why on the templates on our website, you'll see there's like a 250 word template and a 500 word template, just because sometimes they really do count the words. And so then it's pretty simple. You fill out the form, you send your contact information. And again, our templates, it's pretty straightforward. Here a little bit about your story, why these issues are important. And then the ask we have in there is this Mother's Day, ask a new mom how she's doing and let her know about Postpartum Support International and the National Maternal Mental Health Hotline. So there's our little catch at the end, our little ask at the end. Okay, next slide, please. All right, I know that was a lot. Again, all of that is on our website. And then the very last thing that we're going to talk about is following up with your elected officials in Congress. So again, we had Advocacy Day in March. We asked them to fund the Maternal Mental Health Hotline and grants to states and our new legislation. And so now what we need is people to follow up, to keep that pedal on the metal, making sure that these issues stay top of mind to our elected officials. So next slide, please. So again, we have a draft email, as well as links to your elected officials, because people are like, who's my congressman? So again, on our website, and I think we'll go visit the website after we finish this, but it shows like you can click a link to how to find your elected officials, whether it's your senator or your member in the House of Representatives. And we have, again, a draft email to send them to fund these specific things. So again, it's all cut and paste. Next slide, please. And again, the 3 advocacy requests are funding for the National Maternal Mental Health Hotline, funding for the Maternal Mental Health and Substance Use Disorder Program that funds grants to states, and then co-sponsoring our new legislation to support military mothers. So again, these are all at the national level. So these would be advocacy requests that we want to submit to our members in the House of Representatives and the U.S. Senate. And I know, let me just stop talking there, and I'll wrap up with another point in just a second. Okay, so next slide, please. All right, so in summary, 3 ways you can advocate in May. Number 1, raise awareness with the social media campaigns and the hotline materials. Number 2 is to write an op-ed letter or an article or a blog post. And then number 3 is to email your elected officials. And so do we have emails of the staffers? Okay, great question. So Nika's asking a question. Do we have emails from the staffers from our advocacy day? We do. And if you want to email them directly, reach out to us and we'll provide it. When you go onto our website and we have the links to find your congressman, once you type in your zip code, it actually takes you right to the web page for your local elected officials. So that's another way around that. I also saw something in the chat earlier about contacting your state officials. Now, we don't have information about your state officials. So these would be people like if you're, in Virginia, there are people who are members of the General Assembly. But we certainly encourage you to reach out to them as well, particularly if you are in a state that has, say, a perinatal psychiatry access program. We want to make sure that those continue to get funded also at the state level. And so we can share some information about that as well. Okay, so Mia, is it possible to go to our website and show everybody the page that we keep talking about? Awesome. Okay, so I'm pitching Mia this idea on the fly, but I think we can do it. Yep. Okay. Yes. So I'm just scrolling back through the questions. Yes, you'll get a copy of the slides. We're going to email everything afterwards. We're going to send you a survey. We're going to send you a copy of the slides. We're going to send you the link to this recording. And we're going to send you a link to our website that Mia is going to show us as soon as she can make it happen. Where we have all of this information at your fingertips. Awesome. So again, here we have 3 ways to advocate in May. So the first is email your elected official. And you can see right there, we have those 2 links. Find your senator, and that will take you to a website where you just type in your zip codes, find your representative, and then you can also click and get the template for the email to send them. Perfect. Okay, and then the second is write an op-ed letter. So same kind of thing, you can get the template for an op-ed letter. And this is when we offer 2 versions, a shorter version and a longer version. You can use it to send something to your newsletter, your local newspaper, post a blog post, write an article, take what we've given you and just, do what you wish with it. Third is to raise awareness about the National Maternal Mental Health Hotline. We've got a link that goes right to the hotline website where you can download materials, whether it's those little palm cards, little wallet cards, or posters or magnets. All of that is free, and you can distribute it. And then we have the link to the 3 social media campaigns. So the World Maternal Mental Health Day, Pregnancy and Postpartum Psychosis Awareness Day, and then the Blue Dot Project.
And I will add a link to the forum, the Spanish campaign in the forum after this.
Excellent. Excellent. Thank you. Thank you. Awesome. So we know that was a lot of information. That's why we created this website where you can go and find everything that we talked about. All right. So we have about 7 minutes or so. If anybody wants to add a question, I'm just going to go back through the Q&A. Is there information on key people to contact on our congressional committees we should look at? Thank you, Georgianne, for that question. Any member of Congress is great. And in particular, members of Congress like to hear from their constituents. And so when you put in your zip code and it takes you to the website for your local, for your member of Congress, it's really important that when you email them, you say, I am a constituent. That is the most important thing that will get their attention more than anything else. All right. Can we display the holiness number? I think that means hotline number on our organization website. Absolutely. Share information about the hotline anywhere you can, anywhere you want to. In fact, the HRSA website that we give the link to has the little icons you can download. They have social media information. Yep. So yep, share that information anywhere. Did you say you had a board looking for members or volunteers? Oops, sorry. I'm just kind of glancing through the chat. Amazing resources. This was great. Thanks for all the good information. Awesome. Awesome. Thank you for all the thank yous. Yay. Awesome. All right. So any other questions? Just going through. Yep, you'll get a copy of the slides. Okay, so follow us in all these different ways. Sign up to get our newsletter. Follow us on social media. If you're feeling generous and want to make a donation, we'll take, you know, $1, $100, $1 million, your first car, your firstborn child. No, not the child, but anything else. All right. Is this webinar eligible for continuing ed? I'm sorry. No, we do not, unfortunately, offer continuing education credits. Do you have resources and advocacy for doula work to be paid by Medicaid? State is working on this. I'm sorry, Adriana, we don't have anything specific around that for this year. Okay, I think we've got one more slide. Our big thank you. And then Mia, did you want to launch the poll?
Yes, thank you for reminding me.
Yes.
I can find it. Here it is.
And again, we thank you for taking time from your busy day. How was your experience today? Did you find this webinar informative or helpful? Yes, somewhat, or no? We always want to get feedback from our advocates and our participants, always trying to make things better. All right, please give a big round of applause to our speakers today, to Laura and Christina for being with us. We send prayers to patients who is dealing with a family emergency and was not able to join us today. And again, we thank all of you for taking time from all around the world, all across the country to be with us. Look for an email coming from us afterwards. Mia, when do you think that will go out? Like later today or tomorrow?
Tomorrow.
Okay, and that will have a link to a survey, links to all the information that we talked about today, all the websites and things that we talked about. And you can also go directly to our website and see that advocacy information is all up there already. So thank you, everybody. Enjoy the rest of your day.
Thank you.